So good morning, everyone. So it's great to be here today, and I wanted to really just kick off this morning's session as well as the first of three speakers that you have today to really help give the context in Canada about caregiving and what are the issues, why are these issues that we care about them a lot, because as clinicians here, whenever you're treating a patient, you're treating the family. Right? And you have to understand that first and foremost, that every older patient that I come with, I always say they come with their entourage, which is usually, a family member, friends, people who are concerned about their well-being. And frankly, I rely on that entourage to help them stay healthy and independent. It's important that we always think about treating the entire team. And so this is where, as a clinician, as I started realizing that I'm not just caring for older patients, I'm caring for caregivers as well, I started getting very interested in the policy aspects of this and the context of caregivers, because often they remain an invisible workforce in Canada and one that's really important. And so I want to share with you some of the learnings that I learned in leading the work here for the Government of Ontario, but more as we started taking it to a national level as well. So one of the great things that we get to do is, Toronto Rehab, UHN, Sinai, we all get to partner to create really incredible things. And one of the things is we started to want to work on policy was we want to say, how do we actually create a voice and how do we create an evidence-based policy think tank? And so we did that in partnership with Ryerson University to create a National Institute on Aging. It's Canada's first think tank that's focused exclusively on this research and thought leadership. And it's a great way where all the work that we're doing here every day to kind of think about what is the way that we deliver healthcare can actually help influence policy. And the NIA is home to our National Senior Strategy. So you may have heard last election a great chorus from Canadian Medical Association and all the other groups talking about the need for a National Senior Strategy. And a lot of that work starts here at Toronto Rehab and starts in the work that we've actually been doing. So that's why I want to tie all of today together. When we focus on our National Senior Strategy, we focus on advocating for things like how do we help people stay independent, productive, and engaged? How do we help them lead healthy and productive lives? How do we support the delivery of more care closer to home? And again, my colleagues are going to be talking about not only what we do within the building, but how do you translate that into the community to help people stay healthy and independent? But our fourth pillar, as you'll see, which we think is equally important, is thinking about the entire team. How do we support caregivers? And again, we take this knowledge that we learn by studying policy, which may sound boring, but I'll make you all very excited about it by the end of this talk. But again, we translate it into white papers like this one we published earlier this year about why Canada needs to better care for its working caregivers, not just caregivers, but working ones in particular, when you think this is a major economic productivity issue facing the country. So when we start thinking about who are Canada's caregivers, well, maybe I'll just ask another question of the room. How many of you are actually providing care, as little or as much as it is, to another friend or loved one? Right? They're everywhere, right? Many people, I was meeting with the CEO of one of our major banks here, and I asked him directly, I said to him and his senior leadership team, do you know how many of your employees, I said, how many employees do you have? And they said something like, let's just say 60,000. And I said, do you know how many of your employees are also balancing work and unpaid care? And they said, we're not really sure. And I said, I can tell you, if you tell me you have 60,000 employees, it's 20,000 of your employees. 1 in 3 working Canadians is a working caregiver. But overall, we know that 8.1 million Canadians, 8.1 million, have actually provided care to another person within the last year. So a lot of people, just like many of the folks who raised their hand, many of us there, and that's more people raising their hand than more people who said they even knew about the Canada Caregiver Credit. And we know that, again, when we think about the number of those who are actually employed and balancing caregiving responsibilities, that's 6.1 million Canadians, or about 35% of employed Canadians overall. So we also know that women tend to be the majority of the caregivers, and we know that it's about 54% of Canadian caregivers are women. But we also know that care and balancing that care differs significantly between women and men. Women tend to actually spend more hours caregiving than men do in the week, so that there tends to be a greater burden that's placed on them in terms of also trying to balance a number of different duties. We also that women tend to take 30% more time off than men do to provide care, and that really actually affects kind of folks in the workplace because they're more likely to reduce their work hours, work part-time, retire earlier, or leave work temporarily to care for loved ones. And the challenge with that is that if you don't actually have a long a career, you might not be contributing into your pension as much, and that's why we see old age poverty tends to be more of an issue for women. So it's all connected in that way in these little things. Of course, when we start thinking about this group, the sandwich generation, right? And you can start thinking about folks that you know. These are individuals who might be caring for children right now, but are also caring for aging parents. And we know 30% of Canadian caregivers, so 30% of that 8.1 million group are actually women aged 35 to 44. So this is a large group that are actually stressed on both ends, for example. And interestingly, all the political parties now in Canada are highly targeting this group. They call her Jane. They call this woman a one who's actually working, trying to balance all these duties, and struggling to actually make ends meet. And they're saying, how do we help people like Jane figure things out? Because we know that Jane is one of the most stressed folks in our actual society today. So of course, we know that changing demographics are actually going to influence caregiving as well, because we know that one of the great successes of all the work that we're doing here and across UHN is we're helping people live longer. And actually, we're helping people live longer and healthier lives. But of course, with declining fertility rates, the aging of the baby boomers, we are going to have more older people. Remember, the number of people 65 and older in Canada is going to double over the next 20 years. But at the same time, we're actually worried that we're not going to keep pace in having the number of caregivers that will be available to meet the needs of an aging population. So all of a sudden, how do you actually square that off? Because we've actually built a whole system of care where we rely on these individuals to do all of that care on top of the regular healthcare system. And if they're not available, how are we going to actually pay for all of that? So when we start thinking about what are some of the key issues when we think about Canada's working caregivers, as we mentioned, caregivers remain largely invisible and their role is inadequately recognized. So many of these caregivers are not actually often identified, in our workplaces, in our society. And you remember the cost of that care that they provide is about $25 billion annually. That's if we took all the caregivers out of the system and said we are now going to have paid staff at various levels doing this work. And when I started doing this work and giving talks, I used to use a popular term in the research called informal caregivers. And I had a group of older caregivers come up to me and they said, Dr. Sinha, please stop using the term informal. They said, do you know that I actually run G-tubes at home? I actually run IVs. I do all these sorts of things. If you think that's anything but informal, you don't know what you're talking about, right? And I said, fair enough. Oh my goodness, I didn't realize you're expected to do all this. What should I call you? They said, nothing about me is informal, but what is correct about me is it's all unpaid. So that's why I use the term unpaid caregivers more. But that's actually how much they're saving Canadian taxpayers by doing all of that work on our behalf. But again, they're largely unrecognized by employers, governments, and healthcare providers. And we know that formally recognizing caregivers will be one of the first steps in supporting them and maximizing their contributions. Because if you're not appreciated, why bother doing it, right? It can be challenging work, and it's nice when someone actually sees you. And we also need to make sure that they're equal members of the care team so that they can share information and they can receive information as well, which is always important. Now, we also know that there's a current lack of support for working caregivers, and that actually affects our economic productivity. And what ways do we notice this? Well, we know that caregiving costs are estimated to be about $1.3 billion in lost productivity, absenteeism, and turnovers. When people have to come in a bit late, when they say, sorry, I can't do that extra shift, or whatever the case is, that becomes a problem. And when we actually looked at employers in Canada, when they actually told us, for example, if I lose that that senior executive, because they have to take time off early to care, if I bring in new people, all that training that actually has to occur to bring them up, it's really challenging. CIBC helped us do a report back in 2017, and again, they often noted that 30% of caregivers for older parents took time off work, with the average time being 450 hours per year. Okay, that's at least almost a month of work. And if caregivers leave unexpectedly, again, you lose those knowledge, skills, and experience as well. Healthcare system is also not the greatest system for our caregivers, because often we don't actually see or take the time to identify who our caregivers are. And so we know that we make it difficult to make it for caregivers to find the information they need to actually help navigate a complex health and social care system. And again, we need to make sure that they can navigate and actually access services that are more tailored to the needs of their care recipients. Because sometimes we say, take this, but they're like, but that's not what I need, right? And we sometimes have an abundance of resources that don't match the actual needs of our caregivers, and that's problematic. So how do we actually make sure that we know, how do we match what needs are with actually what they actually want? And again, making sure that people know how to access those services flexibly and better from that perspective. We also need to know that when it comes to dementia, which is one of the big growing concerns we have in our society, that there are additional concerns we need to think about supporting caregivers for those with dementia. In my office yesterday, I was seeing a couple. They're Hungarian, and the wife is having more and more caregiver burnout, and she wants a break. And so I connected them with the Alzheimer's Society, and I said, well, how about, what about a day program and one of these things? And she said, the problem is that that's not really going to give me a break, because none of the day programs here operate in Hungarian. So she said, I would have to go with him, get him out of the house. That's a whole ordeal, and that's not going to really work well for me. And she says, if I go for caregiver counseling, who's going to look after him, right? So, and it was a frank talk, and I said, that's a really good thought. So what can we do better, from that perspective? They also note that, services are not really offered when it's needed, such as weekends or evenings as much as it needs to be. And again, we need to make sure that we ensure services are appropriate with the progression of the condition, because dementia, like other conditions, tends to be a progressive neurological condition. So what might work well this year may not be ideal for what they need next year as well. So as I mentioned too, there are not only financial but emotional and physical costs of being a caregiver in Canada. Again, that CIBC report that we helped work on actually showed that the average caregiver will spend $3,300 out of their own pocket on caregiving. And as you see from the briefing note that you actually have, this new Caregiver Credit that was actually recently launched replaced the 3 previous ones that are available. Let me tell you how generous those 3 previous ones were. One, because you probably never even heard of them. One of them was giving you the $200 a year. $200 a year, and you could get it if you were married to the other person that you were caring for, but not if you were living together. Yeah, that doesn't make any sense, right? So when I showed that data to the ministers of health and finance and that, I said, that's the credit you have, and our data shows that only 9 to 15% of eligible caregivers are taking up that credit. Maybe that was the intent, and they said, well, that really doesn't make sense for anybody. So we said, well, how do we make things different? Because again, $200, thank you, but when the average caregiver is spending $3,300, and that might be on transportation, taxis to get to and from the doctor's office for their friend, because they might be demented and they might not know how to actually access their own funding, or they might need to buy incontinence products or other things. This is where these costs start adding up significantly. And we know that 30% of caregivers report that providing care is stressful, and that it can actually affect their emotional but also their physical health as well, and it can suffer. And again, 40% of workplaces reported having employees taking disability or stress leave partially due to caregiving. So this is why we talk about it not just being a care issue, but an economic and a future issue for all of Canada. And again, we also note that caregivers are not usually provided with any formal information or training to support their caregiver responsibilities. And that's really challenging, because if you just are, most people who become caregivers don't actually plan to become caregivers. It's usually something that happens overnight. You're thrown in at the last moment. And again, if we don't actually prepare people by giving them information on what to expect, especially in something like dementia, then it's just, every day is a surprise, and you're not really sure how to do things, and it can create more and more stress. But also caregivers also want more training from healthcare professionals to get better awareness around the caregiver experience and their needs. So there's many things that we need to be doing to support our caregivers, to empower them, to give them the supports they need to do well. So we made some evidence-based policy recommendations from our latest reports, and one of them is that we want governments to formally recognize caregivers. There's only 1 or 2 provinces in Canada, Manitoba in particular, that actually has a Caregiver Recognition Act, and that's simply just defining what a caregiver is. Because once you're actually defined, this is what a caregiver, because most people who are caregivers wouldn't stand up and call themselves a caregiver. They have to really think about that. So we need to make sure that we identify who these folks are, and that provides a foundation for formalized support. We note that healthcare providers should provide caregivers with the support they need, including assessing their needs, providing training and supports, right? Asking, because the simple question I ask and I teach all my trainees to ask is, look at the caregiver and say, and how are you doing today? I can tell you that 1 in 3 times that answers responded, and Dr. Iaboni will probably agree with me. What happens? What usually 1 in 3 times when you ask a caregiver, how are they doing? You simply ask that question. Yeah. You ask them how they're doing. What's a response that you get? Sometimes it's just bursting into tears. Yeah. It's just bursting into tears. Because sometimes they'll say to us, no one's ever asked me that, right? It's always about the patient, but people forget that I'm actually putting in 160 hours of care a week, and no one's actually asked me how I'm doing, right? And just spending that 5 minutes to actually hear what's going on in there, and the little things that we can do, and how you can advocate not just for your patient, but by advocating for them, you're helping your patient, really makes it important. So it's that important aspect. We know that government should further support working caregivers financially in recognition of the economic value they provide and the personal costs of providing care. We also really stress that about employers recognizing the dual challenges employed caregivers have. And there was actually a working employment panel on caregivers that we had the federal government lead a few years ago, where they actually came up with lots of good ideas that businesses could actually implement to actually help make their environments more caregiver friendly. And I was meeting with our new Minister for Seniors just last week in Ottawa, actually bringing back that report from 2015 and saying, so how are we going to move this forward, right? Because that doesn't actually cost money, right? But if I was saying, if we just create an annual award where we recognize the best employer for caregivers, I said businesses are competitive. They will compete and trip over each other to be the best employer for caregivers because it attracts talent. Okay? And again, we always say that, again, organizations can always do more things that they can actually do to better accommodate. And this is some of the things that we list, and people will get copies of these slides, which really tell you about identifying, making it safe for people to identify themselves as caregivers within your organization, making sure that you have more flexible and creative work policies that actually make them not feel that they have to quietly make a choice between staying in the workplace or being present as an employee, and making sure that we follow up and adjust what we can do. So I just mentioned about how we take the research and the care we do on the ground here every day. We ask challenging and thorny questions, and part of our national senior strategy, this is very wordy, but basically saying that we actually think that we should do better to support those Canadians who are providing care. And so we identified through our policy work that the federal government had some various credits, but they can actually create policies that actually can support our caregivers across Canada. And so one of our big success things that we had, which is largely still unknown, is that in Budget 2017, you have the report there about us getting this new unified income-tested credit. And the government's also committed to actually reviewing the compassionate leave policies, which right now only support caregivers caring for someone at the end of life. We're actually trying to say, can we actually have that compassionate leave policy also support people who might take time off to help their mom or dad get through a surgery, for example, and recover as well. So finally, we need to know that all 3 levels of government are considering and acting on aging-related issues within their remits, and that's really important. But we need to encourage more intergovernmental collaboration around evidence-informed issues and solutions of common concern. That's why I was really proud that when we did the federal Caregiver Credit, Ontario also responded and actually made them actually go together, so they're hand in glove. So Ontario caregivers actually do better than most now from that respect. At Toronto Rehab, our geriatric services are built first around the needs of our patients and their caregivers, and to serve them across the continuum of care. And in our geriatric services that I'm proud to be a part of the team here, it's not just the stuff that we do in the building, but as you'll know that over time we built out a whole variety of services in our outpatient setting that serve people in the community. But more recently, a few years ago, we got some funding from the government to help us start creating a community outreach team where we go into people's homes. We actually provide caregiver counseling and support as one of the services through a specially trained social worker. It's these little things of bringing care to where people are and where they need is really important. And we really take pride in being at the forefront of care, in recognizing the need to continually provide system, policy, and leadership. So hopefully that takes you from what I do and what Dr. Iaboni and my other colleagues here do in our offices to how we start thinking about not just, gosh, that kind of sucks, how do we do this, to actually saying, how do we change policy? And Cindy, I'm not the only Rhodes Scholar in the room. Dr. Iaboni is another. So we tend to attract talent in various ways. But I'm really proud to be here, and thank you for your time.